So, our next journey today is a kidney journey. And I'm very happy to have Jen Hernandez with us here to talk about the kidney structure, function, physiology. We'll talk about CKD as well. And we'll also go from a nutritional aspect related to kidneys. Jen, thank you so much for being here.
Thank you so much for having me, Darian. I'm really excited to talk about this. This is my full-time job. So kidney nutrition that's where I'm at.
See, I know you're the right person for this. And everybody who does, these really educational talks, I want them to have passion for what they're doing. So it's awesome that you're doing this. So let's just jump right in. For our listeners, we're really going to set the ground level expectations here is that the beginning here, we're going to have you understand the basics of the kidneys and understanding especially what are the kidneys, structure, function, physiology, and then we'll move on from that. So without ado, Jen, please take it away.
Thank you. Yeah, so we'll do like a really kind of rough overview and then dive into some of the, questions or things that you really want me to hone in on. But first of all, the kidneys, everybody has kidneys for the most part. There are some situations where people are not born with kidneys, but everyone has two kidneys, more or less, but you can function with just one. The kidneys, they're about the size of your fist, so they're not that big, and they're located on your lower back, so just kind of tucked in a little bit under your ribs. So they're really, really well protected as organs, and they're a little hidden away. The way that they're structured is they have this kind of outer cortex, they have this center like medulla, and then they have the renal pelvis. So this outer area, and then the middle part where a lot of the action happens, and then the pelvis where things are getting filtered through. So the actual like the working unit of the kidneys is the nephron. And there's about 1 million nephrons in each kidney. So there's a lot of these very, very tiny systems that are working on a lot of different things. The actual center of the nephron has the glomerulus, and this is like a little cluster of blood vessels where it kind of acts like a sieve. It's basically filtering nutrients and waste, kind of passing through and deciding what's going to be held onto and what is going to be released as waste. And this is the waste that gets developed and pushed through into our urine. So it's going to be filtering through the ureter and then into the bladder so that we can eliminate the waste, what our kidneys, what our body decides it doesn't need. So all of our blood gets filtered through the kidneys. All of it gets filtered through the kidneys, and that's where it's decided what's being kept and what's being released. So that's kind of like the big overview picture of really how it's working. Now, the different functions, these are things that, again, this is all happening 24/7 in the background without any type of physical or mental awareness of what's going on. But as I mentioned, one of the most important things that the kidneys are doing are filtering the blood and removing waste. So those are some very, very important things that are incredibly crucial, because if we don't have these wastes removed, they're building up the body, and these toxins can cause a lot of problems, including death. So very, very important that the kidneys are helping us eliminate these toxins. And I also want to add to that these toxins aren't just things that we consume, things that we eat or drink, but it's even toxic wastes that are produced in the body just from things that are naturally occurring. So as the body is going through and taking care of a lot of things, sometimes we do develop these waste products that also need to be eliminated. So it's not just what we eat. And that's something that I'll kind of touch on again in a little bit here. But another aspect of what the kidneys do is it's filtering and balancing our fluids and electrolytes. So the fluids, just like our waste product, it's basically deciding how much fluid we need to hold on to and how much we can get rid of, how much we can eliminate, again, going through into the urine. And then the electrolytes, those are things like sodium, potassium, phosphorus, calcium, magnesium. These are the electrolytes that the body and the kidneys are deciding how much do I need, how much do I need to hold on to, and what is an excess, what is too much, or what is the amount that we need to eliminate, that we don't need to use. So it is constantly going through and determining all these different electrolytes, what we need to hold on to, what we need to get rid of. And these electrolytes, they each have their own very important functions, which plays a role in how the body is communicating to the kidneys to say whether we hold on to something or get rid of it. Like sodium, for example. If we're getting a lot of sodium and maybe it's noticing that the blood pressure is coming up, it's going to say, okay, we don't need all of this sodium, so let's eliminate some extra sodium. So it might focus on getting rid of that if we're eating maybe a high sodium diet or something, or if you have blood pressure control issues, the body is going to be working on that. So it's taking care of all of these different things to help determine how these other situations, how these other pathways and roles in the body are being handled. And then I do really want to kind of circle and hone in on blood pressure, because not only are the kidneys looking at the electrolytes that are related to blood pressure control, but it's also focusing on producing hormones associated with blood pressure management too. So it's controlling those electrolytes, but it's also like actually making something to help us take care of our blood pressure management. The kidneys also are very important in other hormone productions. So this includes making red blood cells. So it uses erythropoietin to help make red blood cells, which, many of us think of, we need oxygen, and the red blood cells are what's carrying the oxygen through to our organs. So our organs also need oxygen. So it's helping to make the red blood cells and to get this distributed throughout the body. It's also very important in the formation and activation of vitamin D. So the vitamin D that we're getting from the sun, and in some cases even from supplements and foods, they need to be activated into the hormonal version of vitamin D. So the kidneys play a very important role in that as well. And then tying in the vitamin D with the electrolytes like calcium, phosphorus, and magnesium, the kidneys are also playing a very important role in our bone management. It also helps communicate with another hormone known as parathyroid hormone. It's a hormone that's coming from your parathyroid. So everyone thinks about thyroid glands, but there's also parathyroid glands. And those glands create parathyroid hormone, or PTH for short. And the kidneys are communicating via vitamin D to let the parathyroid hormone help balance our bones. So it's a very complicated structure, but the kidneys are just so much more than just filtering waste. I think that's what a lot of people think of with kidney disease is, oh, it's just going to take care of the waste products, but it's doing so much more. And that's why when somebody has kidney disease, I've never in my 12 plus years as a renal dietitian, I've never come across somebody who only has a diagnosis of kidney disease. There's always something else going on, whether it's related to the cause of their kidney damage or it is a production or a result of the kidney damage. It is not in a silo. There's a lot of things going on. So it is a very, very complicated health condition and diagnosis. And that's why a lot of people with kidney disease, they often feel very overwhelmed, because it's not just a very simple, let's just look at this one thing and let's just go low carb or something. Like it's very, very complex for them to be thinking about all these electrolytes that are in our diet, and then all the macronutrients as well, thinking how they need to balance all of that to protect their kidneys, and subsequently all of these other systems that are connected to the kidneys too. So
Man, that
we'll
was
pause
awesome.
there.
That was awesome. I mean, that was exactly what we're looking for. So it's good to level set and have people again understand what is the structure, function, physiology, whole thing. So let's dive a little bit further into, you mentioned something, and I thought this was a great segue and related to people not knowing the kidneys have kind of a multifaceted function, one related to bones. So what are some other areas that it's great to set the platform, but also to look at what's been said out there that maybe you've observed that is not necessarily accurate about the kidneys, or that we need to be careful about consuming information relating to kidneys that's out there currently?
Oh, yeah. I mean, there's quite a bit. There's a lot of wild information out there. I just posted on Instagram and Facebook about potassium, because this is something that is incredibly misunderstood. And I guess by misunderstood, I just mean that there's a lot of people following really outdated guidelines. So historically, potassium was something to be really cautious with. And and even when I was working in dialysis, and this was 5, 10 years ago, in the hospital and outpatient settings, potassium was just like, you don't want to eat potassium. Just cut out your beans, cut out your tomatoes, cut out your avocado, cut out your tomatoes, etc. Cut out all the high potassium foods, which when people start looking into it, like potassium's in a lot of stuff. And when people are told to be careful, a lot of us have this kind of like all or nothing approach. And so a lot of people think, I can't have any potassium. But potassium is an essential nutrient, even for people with chronic kidney disease. The problem, the root issue is in some cases, and this is usually later stages. So there's 5 stages of kidney disease, stages 1, 2, 3, 4, 5, and 3 is kind of split 3A, 3B. But there's 5 different stages. So stage 4 and stage 5, the later stages of kidney disease, there is a more likely chance, but not high, just more likely than like stage 2, for people to have to be cautious with potassium. Because what happens is, again, if the kidneys are not filtering things well, including potassium, then that amount is collecting more in the bloodstream. And so we see a high potassium level and we would think, oh my gosh, you're eating too much potassium, you got to cut that out. And so the research has not backed that up. And the guidelines that came out in 2020, which is 5 years ago, but people are still just learning about this. But the guidelines are saying it's not necessarily dietary potassium. It's not the foods that we're eating. It's more likely a connection between something else going on. So I'll give you an example of something that I would come across very often. So diabetes is the #1 cause of chronic kidney disease. Diabetes, high uncontrolled blood sugars. Uncontrolled blood sugars can actually cause high potassium levels, not having to do anything with what we're eating, but it's the high blood sugar that is pushing potassium outside of the cell. It's supposed to be inside the cell, and it's pushing it out of the cell, causing a reading of a high potassium level. But again, like somebody could be fasting and it still shows high potassium because the glucose is pushing it out. So that's an example of how somebody could have a high potassium level that has nothing to do with food. And now we're really focusing more on that to say we need to look at these non-food causes or non-potassium food causes that could be creating a high potassium level. But again, historically, we would see a high blood potassium and we'd say, cut all your foods, like stop eating all of this. And it just causes so much fear and anxiety for people that they're just like, I can't have any, I can't have any. But that's been something that I have spent years, like, again, this came out in 2020. I spent literal years educating people on this and talking to them about these other potential causes of high blood potassium that have nothing to do with the foods. So there is a lot more behind that. That's not just a matter of getting rid of potassium. And then the other side the argument for potassium in a renal diet is, one, potassium is incredibly important for blood pressure control, and high blood pressure or hypertension, that's the second top cause of kidney disease. And so most people in the general population are not eating enough potassium, which a lot of guidelines are recommending up to 4,700 milligrams per day. If you ever do, I'm sure you probably talk with people who do like food logs and food tracking. You have them look at their potassium intake. It's probably closer to like 2,000 or 2,500.
Wow. Yeah.
It's significantly low. And so again, we're looking at people saying, oh, cut out potassium, but like they're not even eating that much potassium to begin with. So but potassium is just so powerful and has been shown and studied that a low sodium diet paired with a high potassium diet is really powerful in controlling blood pressure. So again, just this whole topic about potassium, this is a lot of what I educate my clients on, is understanding the power of potassium. And just because you have kidney disease doesn't mean you should be cutting out potassium. Like, you should really be better understanding how much you're typically eating, finding ways to work with the dietitian so that they can kind of help support you in a safe way to eat enough that it actually helps. And I've had a lot of clients, a lot of students that have doubled their potassium level and have been able to come off blood pressure medications because their blood pressure is looking so much better that they don't need the medications, or they're dropped down to like what's known as like a CKD, like a baby dose
Yeah.
of these medications, simply used to protect their kidneys, not used to help control high blood pressure. So I would say like that's a really, really big topic in the kidney community. And so if you ever talk to somebody with kidney disease and you mention potassium, they'll probably, oh, I can't have that. Like, well, why? Like, let's, what about this? What's going on here? Because it is really, truly a great area of opportunity. And I spend a lot of my time talking with people about that.
Wow, that's great information. I think the potassium talk often gets overshadowed by the another P talk, which is protein.
Yeah.
Quite a bit. That is a larger societal, huge discussion
Yeah.
in society right now. But I want to move back just a little bit. And you talked about diabetes. Is there differentiation in this, in the disease pathology with kidney disease in terms of type 1 versus type 2 diabetes for this?
It's essentially they're essentially the same. What's happening is the excess glucose, the extra sugar is causing damage to the nephrons, to those kidney filters. So with that glucose large molecule coming through and damaging that kidney function, it basically takes the way that I've explained it, it's like taking a colander and you just get like, I don't know, like a hammer and you just kind of punch a couple holes in it and now you have these bigger holes. And so like you can still, filter out some things, but like if you put blueberries in there, you're going to lose some blueberries. Like that's just the way it is because that filter is gone. So it's kind of that same case, regardless of the situation behind diabetes. It ultimately is just a matter of blood sugar control to help make sure that that extra glucose isn't causing that kidney damage.
Is there an increased risk for someone with juvenile diabetes since it's starting so much younger and that insulin resistance for kidney disease versus someone who has onset of diabetes later in their life in relation to kidney disease?
I'd have to look at the statistics and the research to see if there is a higher correlation. I can tell you from my own experience, I've only had a couple peds patients
Yeah.
in my work, but pediatric nephrology is like a specialty on top of a specialty. So I'm sure if you talk to somebody who focus on peds, they could probably give, some more insight to that. In my world, in adult nephrology, it is really there is a reason that diabetes is the number one cause, and they do really focus on type 2 diabetes
Yeah.
from this perspective, because it is something that it's not that having like a high blood sugar is gonna like derail everything. It's years upon years, just like chronically high
Yeah.
blood sugars. That's just kind of like making it hard for the kidneys to work and just causing damage over time. So um that's why, if you have diabetes, you might notice that your doctor is checking your GFR, which is your glomerular filtration rate. That's the estimated kidney filtration rate. And so it's listed as a number, but people kind of associate it as like a percentage. So if your GFR is like 90, then it's like 90%. Normal is considered 90 or above, but 60, and like the 60 to 90 range is, depending on your age, it could be considered normal, but it could also be considered like stage 1 or stage 2 kidney disease. So anytime you see like a GFR like in the 60s or 70s, it's a good thing to ask your provider about, especially if you have diabetes, because that could be something that they're going to be checking more frequently, or getting it tested again to just kind of verify that that is truly what it is. Because it needs to be checked at least twice across like 3 months for it to be confirmed as a CKD diagnosis.
Oh, man, awesome. Awesome information. Let's turn into this again. I think this, as we talked about potassium a little bit, turn more into the nutritional conversation. This is obviously to be very, I think, nutrition's very sensitive for a lot of people.
Mhm. Mhm.
And I think it's very important to have honest conversations about nutrition and educated conversations. So, in conjunction with this, let's dive into the nutritional aspects of kidney health here.
Yeah, I mean, there's a lot of different areas. Where do you want me to start?
I wanted you to start where area that works that you see the most and that really makes most sense for you talking, and then we can just kind of go out from there.
Okay. Okay. Well, I'll start from kind of this kind of like higher goal view. So I'm going to start with just kind of energy and calories to begin with, and then we'll get into some of the macronutrients, and then I'll touch on some of the micronutrients.
Perfect.
So, calories in general, people with chronic kidney disease are actually at a higher need for calories. And that makes it even harder because, again, people are really scared to eat when there's foods that they're told that they have to cut out and avoid. So, 9.9 times out of 10, I am encouraging people to eat more calories. And a lot of the population I work with, they're in the boomer era. So they're in their 50s, their 60s. And a lot of people in this generation have grown up through a lot of diets. So there's a really strong diet culture, diet history involved. And when I'm telling somebody to go from 1,200 calories to 2,000 calories, they're thinking like, oh my gosh, she's trying to kill me. Like how in the world, how is this going to protect my kidneys? And I'm talking like, regardless of weight goals, this is just simply when the body is in a chronic disease state and it needs the energy. It needs the energy to do all the things that it's trying to do. So I do work with clients to get them up to a higher calorie goal to make sure that they're not losing weight. Because one of the scariest things is when somebody with kidney disease is losing weight unintentionally and in an unsafe manner. It's more likely than not they're losing lean body mass. And that puts them at an increased risk for sarcopenia, and it puts them at an increased risk for dying. It's just simple as that because their body is literally wasting away. And so I really do focus on them getting a higher calorie goal than the average person because of this increased need. So for people that do, kind of look at calorie estimates, like the standard is 25 calories per kilogram. We're looking at 25 to 35 calories per kilogram for most people. And there's a reason there's a range. And in some cases, it might be a little bit lower, it might be a little bit higher. But that's usually kind of where we're starting at and kind of adjusting that goal from there. So they have a higher calorie need. Now, getting into the macronutrients, there's also a shift there. So between the carbs, the fats, and the proteins, we already touched on a little bit, right? So protein is a really big topic. And this is something that is a bit of a shock for people with kidney disease in a couple different ways. But protein is a big molecule and it's very difficult. It's a bit more for the kidneys to handle, and getting not too deep into the science, but basically the protein molecule, it has amino acids, but it also has a nitrogen component. And it's this nitrogen component that's considered a waste product that the body manages. So when the protein's digested, it's supposed to be getting rid of some of this nitrogen. In the labs, you might see it as BUN or blood urea nitrogen. In people with kidney disease, BUN climbs up. This nitrogen component is building in the blood. So the recommendations are in moderate stages and late stages of kidney disease, a low protein diet might be beneficial. And I say might because there are some caveats there, like it wouldn't be appropriate for someone who's in the hospital or who has recently been in the hospital. It wouldn't be appropriate for somebody who has uncontrolled diabetes because they need that protein to help with their blood sugar stabilization. It's not going to be appropriate for a 90-year-old who's, this is not a point of doing a lot of aggressive interventions, or somebody who's not eating well, somebody who's been losing weight and is already in a state of maybe some protein and lean body mass loss. So there's some situations where a low protein diet is really not going to be conducive in the big picture. But for somebody who is metabolically stable, who is doing well, and they might benefit, then maybe 0.8 or 0.6 grams per kilogram. That's what the international guidelines recommend for stages 3 to 5. I personally, when I'm working with people, I'm actually just starting them at the 0.8 because, as you know, protein's in everything. I mean, they have like
Literally.
protein Pop-Tarts. I saw protein soda. I mean, there's protein everything. So we as a society are, for the most part, doing totally fine on protein for the 0.8 grams. And I oftentimes, when I'm doing my protein calculations for somebody, even when they're cutting back on food, they're still getting like a gram of protein per kilogram of weight. Like they're still doing fine. So when we talk about getting them to the 0.8, it feels like a restriction. But in this case, I'm like, no, we're just going to do a normal protein intake for you. And then we'll see how we go from there. And so one of the first things we see in the labs is usually the BUN can come down a little bit. It's maybe not crawling up so high. So keeping a more moderate protein intake is very helpful. And again, if they're doing anything below 0.8 grams per kilogram, it's really important that they have a dietitian and their doctor that is aware and supporting them in this, because they're at higher risk of malnutrition. They're at higher risk of a lot of other, I tell my clients it's like taking cheddar cheese and making it Swiss cheese. Like, you're just poking a lot of holes into it. You don't want to risk it. So you want to have that. You want to have those people to kind of help oversee and make sure this is safe. The worst thing in the world is to cut out this food and then find out your labs are worsened and your kidney function's worsened. So you really want to do it safely. So that's the protein overview. Carbohydrates, I usually aim for just the standard 45 to 65%. But in many cases, I'm going towards that 65%, because again, if we're going a little bit more conservative on protein, then we've got to find ways to kind of shift calorie needs. We got to make the macros all add up. So I'm going to be looking at more like 65% carbohydrate, but then I'm also focusing on fiber. I'll talk about fiber in a second, but that's a really important part when we're looking at carbohydrates. And then finally, when it comes to fats, I'm kind of looking at the remaining, whatever that looks like, around 35% or so for fat content. But the quality of fats is incredibly important, because again, the kidneys it's not an isolated disease. They are at risk of a lot of cardiovascular issues. The number one cause of death for people with kidney disease is not just the kidneys, it's actually heart related. It's left ventricular heart failure, it's heart attack, it's stroke, it's something cardiovascularly related. So it's very important to not put them on like a keto diet with a very high amount of fats. They need to keep that fat controlled. So about 35% or so from fats, really focusing on polyunsaturated fats, monounsaturated fats, and then, talking about saturated fats. And I do try to encourage people to keep animal fats to a limit. It's not necessarily totally eliminating them. And that I tell people, there's a reason I made plant-powered kidneys and I didn't call it vegan kidneys, because we want to have that flexibility. You want to be able to include as much as possible. So, but you do want to be cautious with saturated fats from animals, because that is strongly associated with cardiovascular problems that people with kidney disease are, again, already at a higher risk of having. So that's kind of the overview of the macros. Is everything sounding good so
It
far?
sounds great. I mean, it sounds amazing. Yeah, I think I'm curious, like, for people that, that are going to listen to this, they're thinking about the nutritional conversation. It's good to keep it within this context of kidney disease. And really, because people start going into, you talked about older populations who are in the time frame of experienced so much diet culture and experienced a yo-yo of all different types. And I could see people listening going, well, how does this relate to my, like, what types of diets that people are on, carnivore, plant-based, vegetarian, vegan, all that stuff, which I think are larger conversations, but keeping it within this, I think, centralizes it and makes it just easier. Like, let's think about this in terms of kidney disease, and let's not go into this rabbit hole of other stuff. Like, let's just focus here for right now,
Yeah, and that's a lot of it too with people with kidney disease, again, because they get lost in the weeds too. So
Yeah.
it's like, okay, let's look at this big picture. Let's focus. Let's create this like hierarchy of opportunities. Like, what can we really look at? What can we hone in on? And let's just take it from there. Because
Yeah.
what often happens is when we do simplify it, there's this trickle down effect of more benefits happening in other areas. So that's why I tell them, like, let's just look at one thing at a time. We set goals, and I said, let's just pick one goal, and it's going to focus on one topic, one area. What's the thing that's really, it's keeping you up at night. It's making you sit down to an empty plate. Like, what is it that's really concerning you? And that's where we're going to focus right now. And we just try to keep it as simple as possible. Cause yeah, it can get incredibly complicated. And there's a lot of what ifs, a lot of what ifs.
A lot of what ifs. And I think the connection to cardiovascular disease is not a common talking point. This, I think, people don't look at kidney disease and make this association with cardiovascular disease. And this I've rarely seen this discussed. I want to dive further into this, but I want to finish on the nutritional aspect and fiber for sure. But let's bookmark this, especially to come back to that, because this is, I know a lot of people will listen to this will go, oh no, I've never heard that, this
Oh,
relationship
really?
here. Yeah,
Okay.
they
Okay.
just won't, they won't associate it together. But all
Mm,
these, think about being in a state of chronic disease is really
mhm,
a cascading effect. I mean, it is like a waterfall that keeps slamming into rocks and wearing it down and destroying other things and carving something else out together with that.
mhm.
So just to bookmark that for sure.
Yeah, absolutely, absolutely. Whereas there's a lot we can dive into about
Yeah.
that and how closely associated they are. Um, okay, so we've done our quick overview of
Mhm.
calories, macronutrients. I'm going to touch on just a couple micronutrients that
Yep.
people with CKD are really focused on. If you meet somebody and you bring up some of these, they'll be like, "Oh yeah, I know about that." Like that it's already on their brain. So the first and foremost is sodium. And this is something that is, again, it's just all over the place, whether we realize it or not. But sodium is very closely tied to kidney health because, again, one of the top causes of kidney disease is high blood pressure, and a high sodium diet is connected strongly with hypertension. So when there's kidney damage, it's the sodium isn't being filtered as well, and blood pressure is not being controlled as well, right? The kidney function is not creating the hormone and helping to manage the blood pressure. So it is very important. And this is what I tell people, even for somebody who has CKD caused by diabetes, if they don't have a history of hypertension, I'm still focusing on hypertension nutrition goals, including a low sodium diet. The guidelines say CKD period means a low sodium diet. And so a low sodium diet is 2,300 milligrams of sodium or less per day. In some cases, for people who have really uncontrolled blood pressure, or they have congestive heart failure, or other problems with their heart, with their cardiovascular system, they might be on maybe like 1,800 milligrams or as low as 1,500 milligrams. So it can kind of vary a little bit. But in general, starting with 2,300 milligrams or less is a good goal because most people tend to get about 1,000 milligrams sodium extra on top of the heart healthy guidelines. So focusing on that low sodium, it really, really is important for not only controlling blood pressure and to help keep all of that, which means there's less stress. Because you think about like if blood pressure is higher and it's physically putting more force into these very delicate nephrons, these very delicate kidney filters, there's all this pressure pushing in that can cause that damage as well. So when we're focusing on keeping the blood pressure down, having less sodium, that alleviates the stress on the kidneys. Another thing too is that it actually um, one of the common symptoms or conditions associated with kidney disease is a term called proteinuria, which is protein leaking in the urine. That's an indication that there's kidney damage because again, protein being a big molecule, it shouldn't be in the urine. It should be retained. But if there is a high level of protein in the urine, that is indicative of the kidney damage. And research has shown that a low sodium diet is really, really powerful to help reduce proteinuria, especially when people are given medications, prescription medications to help with their blood pressure, which also helps with the proteinuria. A low sodium diet is key for the medication just to work effectively. So focusing on a low sodium diet is really important. And that's something that I talk with people a lot because sodium's in everything. I mean, breads and rolls and like tortillas. Like I know right now, the high fiber tortillas are like such a big thing. Maybe they've been a big thing for a while, but I don't know. Instagram's pushing them in my reels. So I'm just seeing a lot of these high fiber tortillas and I'm looking at the nutrition label and everyone's focused on the fiber, which is great. But then the tortilla, like one tortilla has like 600, 700 milligrams of sodium just for that one tortilla. And that's like a third of a person's sodium for the entire day from this one ingredient for one meal. So I just kind of want to put this warning out to people to say like if you're encouraging people to eat something that has maybe extra protein or extra fiber in it, which are good nutrients, but like don't just bypass that sodium because sodium is really important, especially for people with kidney damage. It's really important for them to be cautious with. So sodium, low sodium, looking at breads, tortillas, rolls, canned soups, of course, that's a big one. Um, Basically packaged foods, that's really where you're going to find it. And one of my recommendations, my like kind of rule of thumb recommendations is when you're looking at the nutrition facts, if the sodium in milligrams is less than the calories per serving, then it's cool. It's good to go. Because if we're aiming for about 2,000 calories a day, we're also aiming for about 2,000 milligrams of sodium per day. So like that's just an easy way to see like, is this going to be good for me in sodium? If it's like 50 calories, but 300 milligrams of sodium, like the calories, it's not going to give you a lot of energy, but it's going to take a lot of your milligrams of sodium for the day. So maybe that helps some people. I find a lot of my clients think that that's a really easy, quick way for them to just kind of filter through some things.
I tell you what, I'm going to interrupt you real quick on this because
Yeah.
I just think this is such a critical point in this conversation. I'm going to say why here because the protein conversation drives me crazy. I'm just going to be honest here. It just
Mhm.
because it's often done without providing the nuance that you just provided, which a nuance about sodium.
Mhm.
It's like push protein, but don't discuss the nuance related to other factors within protein. And then talking about protein in the bloodstream. Okay, obviously you're talking about this within kidney disease.
Mhm.
My question is this, because this is a big question, and people listen to this. My students always talk about this protein and stuff. Is there a level with protein consumption being a big molecule then could be kind of a gateway or a cause towards it being in the bloodstream? There's like excessive amounts of
Mm.
this.
Yeah. Well, fortunately, the research shows that healthy individuals who don't have kidney damage, a high protein diet is not going to cause kidney disease.
Right.
However, there's 37 plus million people in the US alone with kidney disease, and about half the country with
It's a serious amount of
diabetes.
people. I
It
mean,
is.
it's
Yeah,
crazy.
it's a lot. And diabetes and high blood pressure, incredibly rampant. So the there is some caution to say, if you have a family history of diabetes, high blood pressure, kidney disease, if you have even a family history, you are at a higher risk of developing kidney disease. So it's important to understand your own health and your medical history, not just what you currently have going on, but like what are you at higher risk of? Because that could play a role where, again, just a healthy individual, that protein's not going to be problematic. But the worst thing in the world is to push it too far, and then there is, you know, kidney damage or there's problems that arise from that. So does that
Right.
does that help?
No, that's great. No, it's just that's what I love about these conversations, a more nuanced conversation. And I've definitely seen the data on that in terms of protein, but I just for healthy individuals, just parsing through, especially like
Mhm.
the sodium discussion. I can tell you that most people I talk to have never had the sodium discussion related to protein, ever,
Yeah.
like
Yeah.
ever. And that's because it's kind of a blanket discussion about protein versus let's dive into the weeds. So thank you for doing that.
Yeah. Yeah, of course. I always I really get heated about it like on social media when I'm going through things and people are saying like, "Oh, make this like protein something and add all this stuff." And I'm just like, "That's like a day's worth of sodium right there." Like they totally bypass it. And I know like yes, your kidneys will do you an incredible favor and eliminate the sodium that you don't need. But like if you're doing that over and over, like if you're doing that consistently, like yes, physical activity is going to be a really, really great lifesaver. And getting a lot of potassium is also going to really help offset that sodium too. But, it just in general, high sodium diet is not beneficial for most people. There are some health conditions where high sodium diet is needed, but that's not for the general population. That's not for the
Yeah.
majority. So I do feel like the more that people talk about a low sodium diet, there's just, there's so many benefits to it.
Now that makes a lot of sense. Let's keep it moving. I mean, this is unbelievable. And again, I want to keep bookmarking the cardiovascular aspect to it. But if there's anything left that you want to discuss related to this, let's definitely get to that and then jump into that other
Yeah,
conversation.
I'm gonna actually the next micronutrient I'm talking about is a great segue into the cardiovascular. So I'll probably just like organically bring
Let's do
that
it.
into the picture. So the other micronutrient that I want to kind of highlight is phosphorus. And this is another one that's just like not talked about whatsoever. And yet the majority of people are consuming way more than they need, like way excessive amount. But again, when you have good kidneys and when you have good filtration, it's not a big concern because your kidneys are going to see it and like, okay, we don't need that. Cool, move on. But for people with kidney disease, when you're consuming larger amounts of phosphorus, then this phosphorus builds up in the blood and actually causes bone damage and cardiovascular disease. So I'll get into some more like the back end of that, but I want to first explain the dietary phosphorus differences because there is some nuances within that. So phosphorus, there's two types. There's organic and inorganic phosphorus. Organic phosphorus, think of it as the phosphorus that's just naturally found in foods. So we have phosphorus. We naturally have phosphorus in our bodies. That's part of our composition. Animals, animal meats, animal proteins naturally have phosphorus in them because it's part of their body composition. Plants have phosphorus. It comes from the soil. It is part of plants as well. So it is already found in a lot of foods. Inorganic phosphorus is the kind that's added to a food product for various reasons. Primarily, it's used as a preservative. It can be used as a nutrient booster. So like a food with added iron, it might be in the form of ferrous phosphate. So it's a type of iron with phosphorus that comes with it. These added, this inorganic phosphorus is the kind that is more problematic for people with CKD because it is more easily absorbed. Our bodies do not have the enzymes to break down the organic phosphorus. We don't have that ability, but the inorganic kind is easily broken down. Like again, some of it is nutrient related. So it's made to be broken down so our bodies can absorb it. So this inorganic phosphorus is the problem child because it's in so many things. And if you ever start looking at ingredients list, just look for PHOS because it can be really deceiving. The easiest like go-to example is like a dark cola soda. You'll probably see phosphoric acid. That's like I've been giving this example for 10 plus years. And this is the kind that, again, that's really easily absorbed and it's found in a lot of our foods, a lot of our processed foods. Not all of them. There are some companies that, don't use phosphorus additives, which is fantastic. And even now there's currently some legislation that's trying to move through to help make phosphates more prevalent on lists, on labels, because of the association with these phosphates and cardiovascular disease, bone diseases, kidney diseases. So this is the problem. So in the realm of, again, protein, when people are eating protein rich foods or they're eating protein supplements, they're taking protein shakes, powders, bars, whatever, that's a place where phosphorus might be. And so if they're focusing on protein, and not to mention, I'll also add, again, like we have phosphorus, animals have phosphorus, protein rich foods tend to just come with higher amounts of phosphorus anyway. So what's happening is if somebody's eating a lot of protein, they're kind of automatically eating more phosphorus. And so that in of itself can be problematic because what happens is when this phosphorus is absorbed, and if it's not filtered well, you have this extra phosphorus floating through the blood. And phosphorus and calcium are basically best friends. They love to be together. And what happens is this phosphorus is coming through and it's like, where in the world is calcium? Where's my BFF? And it's pulling calcium from where our body keeps it, which is in the bones. And so it's literally pulling calcium out of our bone, creating these crystals that are floating through the blood, and eventually they're settling in our soft tissues. And if this is happening months and months and months, years and years and years, all of these crystals are hardening our arteries. And this is known as vascular calcification, literally turning our vascular system, our arteries, our veins into stone. And a visual example I use with clients to explain this process is, you ever see like red vines or even like, I don't know, like a licorice that's hollow, right?
Yeah.
It's flexible, it's squishy. You can bend it, you can move it. Compare that to an uncooked penne pasta. Very rigid, not good, not moving, not flexing the way you want it to. So you're going from this red vine type artery to this penne type artery. That's not going to be helpful in blood pressure control, where your blood pressure, your cardiovascular system, it's supposed to flex, right? It's supposed to be able to open and close and
That's right.
adapt
The
to what our body needs.
vasoconstriction and dilation. Yeah, I was just talking to
Yes.
students about this in blood vessels and endothelial lining of blood vessels and pliability and flexibility. It sounds what you're saying is this also is now becoming another factor towards decreasing that pliability in that.
Yes, absolutely. And this is something that just over time, just like, kind of like a parallel example would be high cholesterol levels. When that plaque is just kind of filling up the arteries and the blood vessels, it's making it harder for blood to come through. And so it's creating, again, high blood pressure, it's creating heart thickening. So again, the number one cause of death for people with kidney disease is left ventricular heart failure. So it's causing these problems and it's just reducing blood flow in general. So there's a lot of problems that are coming from, and this is like chronically high phosphorus. This is not like if I have somebody who has a phosphorus of like 5.7, like a little high, not crazy, but it's just like a one-off lab. Like that's not the kind of problem we're looking at. I'm talking about somebody who has a phosphorus level of like 7, which is quite high, and they have 7s in their monthly labs for like years. This is what we see. And then what can happen over time is that we see their calcium levels in their blood reports that drops because all that calcium is binding to that phosphorus. And so it's dropping the calcium levels. So this is just this whole thing. And the bigger term for it is CKD MBD, mineral bone disorder, or mineral bone disease. This is just kind of this whole association of all this stuff happening where phosphorus is building up, causing these problems. So, and then also this calcium change too is affecting the parathyroid, what we talked about earlier, the PTH, because PTH is designed to control calcium. But now PTH is freaking out because the calcium levels are off, and then the hormone, parathyroid can't talk to the kidneys very well, and so that can't. It's a whole mess.
Very
It's
messy.
very, very challenging. It's very hard, and so in some cases, there's medication to help. There's parathyroidectomies where people have surgery to remove some of the glands so they're not producing the hormone so much. I've even had a case where, man, this is back when I first started dialysis. This is like 12 years ago. Somebody was scheduled for a kidney transplant. They got on the table, they were opened up and closed up right away. The vascular calcification was so bad, they couldn't get the new kidney anywhere.
Oh my
The
goodness.
person woke up thinking they were going to have a kidney transplant. Didn't happen.
And there was no idea about this ahead of time that this was potentially.
No, and it was, I can't remember all the details. It was a long time ago. But it was something related to some, like they didn't have like the latest scans or something, but it
Yeah.
was just something that they
Wow.
didn't see. Yeah.
Wow, that's just like that's actually mind blowing to think it's
Yeah.
that bad. And I
Yeah.
want to reinforce the left ventricular heart failure. And for the audience, to why this is so critical is the left ventricle is where stroke volume occurs. And with poor stroke volume, ejection fraction changes, all these things lead to less blood going out to the rest of the body and to all the organs, creating even more of a mess. That's what I mean, this is just incredibly messy
Mhm.
disease. That
It is.
I mean, it feels like it's just like one hit after another, after another on this. So, like a really serious condition.
Yeah, and I do want to put like a little bit of silver lining. I'm a very positive person. I am not a Debbie Downer. So I do want to say like a lot of these situations are not typical. Um, so this is again, like I think a lot of the explanations and the examples I gave, I would say like, months and months and months. This is like a long time of not doing anything.
Yeah.
I have so many examples from clients and students who have maintained or even improved their kidney filtration rate, just with like healthy diet and lifestyle changes. There's so many of those types of examples that are there. And that's why like a lot of the research coming out is saying like, if you have CKD, you need to have a dietitian, because we see that it is very important. Like we acknowledge that this does make a big difference. So yeah, I do want to just highlight like there are a lot of great resources and opportunities for people to be able to not get to those extreme poor outcomes.
So the recommendation is to have regular connection or consultation or sessions with a dietitian if you have
Mhm.
CKD. I didn't know that was the recommendation. Yeah.
Yeah, it's on the international guidelines, and they say that basically a dietetic consultation is it's the top tier, which I still, I still hear doctors telling people like, "Oh, you have CKD3, you don't need a dietitian. Don't worry about it." Diet like they're not keeping up
Why would
with the
they say
nutritional
that?
guide.
Like, just because they don't know? Or I mean,
They don't know. They don't know. And I will say a lot of nephrologists, like 90% of their patient population is dialysis. So
right.
like they're really in the dialysis setting more so than the CKD setting. And then there's also, they might not even know we exist. Dietitians are not big. We do not go through any type of education about marketing or even private practice. Like
Yeah.
me creating my private practice was wild to a lot of people. But this is something that is becoming more on the forefront. And now that we have those guidelines that support and back nutrition and medical nutrition therapy, like now we're finally being like, yay, we knew it. We're doing
We know
something.
it.
Yeah. So yeah, there are a lot of great benefits. And I always tell people too, if your doctor says you don't need a dietitian, you let's say, okay, can you please chart that? Can you please write that on the note for
Mm.
today that I requested this referral and you denied me the referral because I feel like my insurance might need to know about this. Like just and in some cases, denying a referral like that could be considered malpractice.
Oh,
I'll just throw
interesting.
that out there too.
Wow, very interesting. Well, as we're getting close to the end here, let's talk a little bit, as you mentioned about. I'm the same way. I want to find solutions for people. I want to be positive about things. Let's talk about some modifiable factors outside of just nutrition that can be done to help with chronic kidney disease here.
Yeah, yeah, and there are so many truly. Like I could list a dozen just from the nutrition side alone. But if we go even outside of nutrition, some of the things that are incredibly important, it's sleep. Like, sleep is also kind of having its moment, which is really
That's right.
wonderful. Yeah, people need good sleep. There are things that our body is doing that it can only be done during sleep. We need that restoration. And there is a strong connection, a strong association with chronic kidney disease and sleep apnea or restless leg syndrome and like just sleep health concerns. So focusing on, what can you do related to your sleep health? If it's related to going to a sleep study or talking with your doctor about some type of intervention or even medications or something like that. Um, there's a lot of areas for opportunity on what can be done just for your sleep health. So developing a better bedtime routine for yourself, shutting off the screens, like all that kind of like standard stuff you hear that nobody wants to do, but like it's important. It's important. So definitely focusing on sleep is important. Another aspect that is incredibly powerful is physical activity. Like really, really important. And a lot of people with kidney disease, they're scared to be physically active. One, because they might not have the energy, because like tie back into the beginning when I was talking about calories and
That's right.
energy, but they need to exercise. But they're maybe not feeling like they have a lot of energy. But also, exercise is very strongly associated with good outcomes for people with kidney disease. And it doesn't have to be, I think people, they again think of it like in this all or nothing mentality, but we're saying like a 10-minute walk after lunch or after dinner or something. Like it helps your digestion, it gets you some fresh air, 10 minutes. And even if you're not outside, like just walking around your space, like just walk around, get a little bit of movement in. It's incredibly helpful. But physical activity, particularly just walking, is incredibly, incredibly helpful for people. So setting a step goal, whatever it is, plus 500 steps or whatever the case is, like take those baby steps, get more physically active. One of my clients, she was like, it's really hard for me to get out. So I just took my spare room and I turned it into a home gym. And so I'm seeing her log her elliptical and her bike and her treadmill. She's like logging this stuff in and she's doing so, so well. So, any kind of movement that like you enjoy and that like feels good to you is going to be beneficial. Even weightlifting. Some people ask me about like, okay, what about weightlifting and weight training and lifting heavy weights? Like, yes, that's still great. It will, if you do like a heavy intensive workout right before a lab draw, it might impact your labs a little bit. So either you just don't do a heavy lift the day or two before labs, or if you do it, make sure your doctor knows. So when they're reviewing the labs, they know that that's a factor involved. Um, but weightlifting is really fantastic too. And I've had clients that have had great results in doing weightlifting. So Any kind of physical activity that you enjoy is really, really great. Aiming for the 150 minutes of moderate activity per week is awesome. If you're at 0 minutes, aim for 30 minutes per week. Set a small goal that feels really tangible and feels really good. I always tell people, like, if you say the goal and it already scares you, then that's not your goal. That's not your plan. You've got to
Right.
think of something that actually empowers you and makes you think about your life and think about, like, yes, there's nothing standing in my way of doing this, and repeating it. That's the key too.
That's
But
definitely key. Yeah.
but yeah, so I would say like those two things are incredibly important. Um, Trying to think if there's any other kind of big ones. Those are really the biggest ones that I can think of right now. But
Yeah.
nutrition, we got a lot too.
Yeah, I know we hit a lot on that. This is wonderful. And clearly your passion and your knowledge on this is like spilling out of you. You
It,
are
it- it's a problem. It's a problem.
it's
I'm
like
working
your
on
thing,
it.
Jen. I mean, and that's why I was so excited to have you on. You just this you're fluent. Very fluent in this and it's so recognizable. So I just appreciate the education you're putting out there for so many people. And there's lots in here that I think is going to be pretty eye-opening to a lot of the people who are going to listen to this. So I'm just so grateful for that. And we'll have all your information in the show notes so everybody can connect to Jen and on all the wonderful things she's doing. But if you have any parting wisdom, please feel free to share that. You know,
I the only thing I can, like, off the top of my head right now is I recently, just about 2 weeks ago, published a book, less than 2 weeks ago. So I do have a book all about the stuff that I've covered today and more. There's a whole chapter on protein, there's a whole chapter on phosphorus, there's a chapter on oxalates, which is another big dietary kidney
yeah,
concern. But if you're interested in like a resource for yourself or for people with CKD, I've already had really great reviews on it. So it's on Amazon, and I did provide a link so anyone can learn more about the book. But I think it's just a matter of giving people knowledge, and like you mentioned, it's that positivity. It's that, like, just knowing that there are opportunities and resources available that just a lot of people aren't aware of. So that's my goal, is people knowing that there's these kinds of resources available.
yeah, most definitely. And then you can get better. And so much of the our chronic illness that we have as a society is they're modifiable, and
Mhm.
they're things that we can get done. It can feel overwhelming, especially when people are dealing with chronic illness. It's very depleting. Just having this on your everyday, but it does get better. It can get better, and hopefully this will help anybody listening to this that is experiencing this. Hopefully this gives you some hope and some jet fuel for you to just keep moving forward and help yourself to be the person you want to be outside of this. So
Yeah,
awesome.
yeah, that's it. That's it.
That's it. Thank you so much, Jen. I appreciate you.
Thank you so much for having me, Darian. This has been a lot of fun.